Hi, I'm Lacey Cam.
And I'm Brittany Moganum.
We're at the Carlson College of Veterinary Medicine. This is Chopper. He's a teaching horse. He's going to help us with the hind limb musculoskeletal exam. I start the hind limb exam by actually examining the back. We'll palpate the epaxial muscles just with the fingertips, not with the fingernails. I'll give a firm pressure to the epaxial muscles on either side of the spine. To palpate the sacroiliac joint, I'll go just a few centimeters lateral to the tubersacral. Again, firm pressure with my fingertips, pressing down into that region. A normal response is just a mild give to my fingers. Then we'll go ahead and go to the hip joint. You can feel the greater trochanter. Often horses with hip arthritis, they have some significant gluteal atrophy. It's a great sign that they've got something going on in their hip. And also pain to palpation, pain on abduction of the limb. After the hip joint, we'll follow the femur down. You can palpate either side of the femur for pain. To palpate my stifle joint, I'll start with the middle patellar ligament. I call that home base. It's a structure just below the patella. It feels like a pencil, and I can squeeze it between my fingers here. Below that, any sort of swelling is the femoropatellar joint. Then if I roll my finger medially, I'll go over the medial patellar ligament. Just behind that is going to be the medial femorotibial joint. Then, returning to home base, middle patellar ligament, I'll do the same thing on the lateral side. If I roll my finger laterally, I'll go over the lateral patellar ligament and be right on the lateral femorotibial joint. Next, I'll palpate the tibia and the tarsal region. So I'll palpate either side of the tibial bone for pain, and then we get to the tarsus. The tarsus includes 5 joints. The tarsal-crural joint is the one with the greatest range of motion. The tarsal-crural joint is a common location of OCD lesions. Effusion is seen in the tarsal-crural joint on the plantar aspect of the joint and in the dorsal aspect of the joint at the level of the medial and lateral malleoli. The proximal intertarsal joint communicates with the tarsal-crural joint. The talocalcaneal joint lies on the plantar aspect of the talus. Then we have the distal intertarsal joint and the tarsometatarsal joints. These 2 distal joints are common location of arthritis. We can palpate the tarsometatarsal joint at the proximal aspect of the lateral splint bone. We can palpate the distal intertarsal joint on the medial side just at the level of the chestnut. Here's where I like to do some range of motion activities with the horse. So I'll ask him to lift his leg, gradually bringing my hand on the inside of the leg and lifting at the fetlock region, holding at the toe. And then we'll see his range of motion. A normal horse can bring their fetlock almost all the way up to the stifle. So that's a very normal range of motion here. Now we'll move on and we'll palpate the soft tissues in the back of the cannon bone region. There's 3 important soft tissues here, the superficial and the deep digital flexor tendon and the suspensory ligament. I'll palpate each of those by squeezing them between my fingers, looking for pain or swelling. And then at the suspensory, we'll palpate the suspensory ligament by pressing our fingers on the inside of the splint bone and all the way against the cannon bone. This is going to press on the origin of suspensory. I have to move the digital flexor tendons out of the way in order to make this pressure happen. Once we get further distal from the origin of suspensory, I can palpate the suspensory ligament between my fingers like the digital flexor tendons all the way down to the sesamoids. Then we'll go ahead and let the horse stand and look at the fetlock joint. Now we'll move on to the fetlock region. This is an important area because it's got the fetlock joint and the tendon sheath, and they're fairly close together. The fetlock joint itself can be palpated. Effusion is seen between the cannon bone and the suspensory branch, right here in this area, and also cranially in the front of the fetlock joint. Importantly, the tendon sheath is just caudal to this, running from above the fetlock all the way down to the pastern. You can feel effusion in the tendon sheath by palpating above the annular ligament in this region. Then we'll look at the foot. Commonly, I'll put the foot between my knees and use a hoof tester. We'll just gently rest it here so we can have both hands available. I'll squeeze on the foot in several areas, making sure to get the toe and the heel region, looking for any sort of a painful response or abnormalities in the sole itself. Thank you for watching this instructional video from Oregon State University.